Hi, I'm Dr. Sharyl Truty. Welcome to our lunch noon health hour Facebook Live presentation on IV nutrition. This is our third presentation out of three talking about the benefits of IV nutrition. My name again is Dr. Sharyl Truty. I'm owner of Balanced Physician Care, which is a practice of integrative medicine and primary care here in the Jacksonville area located at the beaches. Our website is balancedphysiciancare.com. So today we're going to talk a little bit about some specific IV protocols and how they can be beneficial. In earlier segments, we were talking about the benefit of IV nutrition and how there are a lot of people who suffer with issues with nutrient depletion. And some of that comes from our foods not being as enriched in nutrients as they should be. Some of that comes from our own lifestyle and dietary habits. Some of it also comes from our medications and different chemicals and substances that we encounter in the environment. And so there's a growing understanding that sometimes our nutrition goes beyond just what we eat, and looking at trying to replace, some deficiencies that we may have, perhaps because we don't take in enough, perhaps because we have some chemicals or medications that are interfering with absorption, perhaps because we have gut issues and medical issues that prevent that absorption, and how everything in our body interrelates and plays a role together. So today I'm going to talk a little bit about one of the, I feel, is a very important nutrient in our body, and that is magnesium. I'm also going to talk a little bit about how magnesium as well as L-arginine can really be helpful in helping with hypertension. And then finally, I'll talk a little bit about ALA, which is alpha lipoic acid, and how a powerful and antioxidant it is, and the many benefits that it can have for a lot of people. So magnesium, again, is very important. It's involved in over 350 different enzyme activities in our body. And oftentimes, though, magnesium deficiency can go undetected. If you Google and read a little bit about magnesium levels, you'll find that there are several papers on the challenge of it is in finding out what our true total body magnesium level is. Our standard serum magnesium, we don't feel is a really good reflection. A lot of us rely on an RBC magnesium, and we feel that that gives us maybe a better indication of what our total tissue body magnesium levels are. But even that seems to fall short. There's proposals such as doing 24-hour magnesium collections to get a better accurate reading, doing hair analysis of magnesium to get a more accurate reading. But regardless, it's difficult to kind of put a handle on where our magnesium levels are. So there's a lot of people who may have had blood drawn or may have entertained this idea and not really realize that they may be a little more deficient. Typically in our practice, I check because it's just practical and easy in RBC magnesium. And when I see people on the low end of normal, I certainly begin to consider that they may have suboptimal levels of magnesium. And especially when that's coupled with a lot of diseases that have been implicated in magnesium deficiency, that begins to turn my head that maybe there's something here that we need to take care of. There's a lot of indications that muscle cramping in the legs, back pain, just regular everyday muscle aches and pains can be improved by improving our magnesium levels. There is a big correlation between migraines and low magnesium levels. So there's another chronic disease that can very much be influenced by magnesium. And then the heart. I can't say enough about this, but there is a lot of indication that magnesium plays a big role in our cardiovascular system. For one, it's definitely felt to perhaps be a rhythm stabilizer. So anybody who maybe has what we call some premature ventricular contractions or some rhythms that are supraventricular, tachycardia, rhythms that are very fast but are normal, or been told by a cardiologist they're normal, looking at your magnesium levels might be something worth taking a look at to see if we can cool that overexcitability of the heart down. So again, clinical trials have shown that improving magnesium levels can play an impact on hypertension as well as, again, the rhythm of the heart. So a lot of times it's difficult to take oral magnesium or by oral magnesium to get the levels by which we desire for the whole body and the whole tissue. Again, if people have gut issues, sometimes their gut is sensitive to magnesium. There's several patients I've met who've done different forms of magnesium and still can't tolerate it because they have issues with diarrhea. And again, there's always a question of absorption. So this is where I think really taking a look at doing IV magnesium is a reasonable thing. Here at our office, we offer IV magnesium therapy. And again, we do it in a very controlled setting where we're monitoring you and being sure that we are not going to cause any issues with your electrolyte balance or your heart rhythm. So we have the dosing and the protocols that have shown that we can do this in a very safe and synchronized fashion. In fact, one of the things that we often put along with magnesium is vitamin B6. And vitamin B6 has been shown to, when given along with magnesium, to help the magnesium be pushed more into the cells where we want it to be and not just stay in the serum and maybe cause any rhythm issues. Again, going on to other IV therapies besides just purely IV magnesium, we have a IV protocol for high blood pressure. And I found this very exciting as we've started to implement this. One of the components of the IV therapy for high blood pressure is L-arginine. And L-arginine is an amino acid that's found in proteins. And it's very important for the synthesis of what we call nitric oxide. And the nitric oxide chemical in our bodies dilates blood vessels. When we exercise in a cardiovascular way, our body naturally produces nitric oxide, and that is what allows exercise so L-arginine is important for the production of our own nitric oxide. And so studies have shown, particularly one study by Del Olmo in the Annals of Italian Medicine in 1995, that L-arginine can reduce systolic blood pressure by 16% and diastolic blood pressure by 11%. And that's pretty impressive. So if our hypertension formula incorporates L-arginine along with magnesium. And magnesium also has some evidence not only of providing benefit to heart rhythm, but also in perhaps reducing blood pressure as well. And we do that along with a vitamin B6, again, to achieve really good tissue absorption. So another great IV therapy. So we talked a little bit about IV magnesium alone as being beneficial for many conditions, anything from brain issues, mood issues, fatigue, back pain, migraines, and high blood pressure. And then we've talked a little bit about a hypertension combination with L-arginine and magnesium and the benefits that that can have for anyone dealing with heart issues. The last IV therapy that I want to talk about is ALA, or alpha lipoic acid. And this is an emerging antioxidant, and it certainly has a lot of powerful benefits. It's a little unique in that it is both water and fat soluble, and that makes ALA be able to have widespread abilities. It also has the ability to cross the blood-brain barrier. And this is where we've seen that there is some indication that ALA can improve conditions such as chronic fatigue and mood issues. We also have been, there's a very promising studies with ALA, particularly IVLA, in helping peripheral neuropathies. There's also evidence of it helping with liver and diabetes issues as well. So it helps to stimulate liver regeneration. So here at our office, that's our third one of our therapies is IV ALA. It certainly is an IV that you want to proceed with caution. In our office, we do a gradual stepwise fashion in order to be able to get up to the levels that we feel are very beneficial in these types of medical conditions. So again, all of our IVs that we provide here at Balanced Physician Care are always done in sort of a very safe and very monitored environment with thoughtfulness as to each individual's entire medical picture. So if any of these IV therapies have caught your attention for you or for friends or family members, I'd be happy to tell you more about what we do here. Typically at our office, we want to make sure we know the people that we're doing our IV therapy on from a medical perspective well. So we usually have patients come in for a brief consultation. We go over their medical history, make sure we have certain labs that check their kidney function and labs that check a particular enzyme issue called G6PD deficiency. And then we take a look at your entire medical picture. And then from there, we make our recommendations as far as IV treatments, what seems to work best for you, and how many treatments that you might want to get the effects that you're desiring. So please give us a call. Balanced Physician Care is the name of our practice. Our phone number is 904-930-4774. That's 904-930-4774. And our email is membership@balancedphysiciancare.com. We also have some information on our website, but we're also happy to email you more detailed information or just give us a call. So thank you very much for joining us today and joining us these past several Facebook Live sessions learning about IV nutrition and IV therapy. We'll probably in the future be scheduling some more, again, to help you understand what novel and holistic therapies are out there for both you and your family. Also, at our practice, Balanced Physician Care, we are a primary care practice, and we do integrative medicine therapy as well. I have been trained in family practice in sports medicine, and I've been doing that for over 14 years. I'm also trained in integrative medicine and acupuncture. And so we provide all of these things here at our practice. One of the unique things that we do at our practice in our primary care sector is we have a membership-based practice. And for patients who are really looking to have a really good relationship with their doctor, be able to spend as much time as they want with their doctor, and be able to just have a physician at their fingertips on evenings and weekends should any issues arise, I would encourage you to take a look at our membership-based practice. We have two levels, a basic and a premier. Our basic membership is provided by both me and my nurse practitioner, Dee Dee Carter-Sachs. And together, we take care of all of our basic members. Our basic membership starts out at a very affordable price of only $69 a month. And for that, again, you get all of the benefits. I mean, for most people, that's less than their cell phone bill. And we're available for you by email 24/7 and are able to come and take care of you in the office or by phone on nights and weekends. So if this has sparked your interest, we have some more information on our website. But for a limited time this summer, because we are just excited to be able to offer what we feel is a great product to those patients who maybe don't have health insurance or have a high deductible plan, or are young and maybe only have a few medical issues. We want to be able to introduce you to this great basic membership plan that we're offering. So for this summer, we are offering it where if you sign up for our membership, we will give you the first month for free. So that means that if you sign up, that $69 for the first month will be waived. So please take a look at it. For our membership, we are looking to develop an ongoing relationship with you. So I think, it's a great opportunity, if this has sparked your interest before, to go ahead, give us a call, come in for a 10-minute free consultation, find out what we're about, and give it a try. I think this is a fantastic value, and it's only going to be available until the summer is over. So if you've thought about it, now's the opportunity to take advantage of it. Come in, check our practice out. Again, that is if you sign up for our basic membership this summer, we'll give you the first month for free. So thank you very much for tuning in today to our Facebook Live Health Lunch Noontime Talks. We offer them frequently on Thursdays. Please check out our website, balancedphysiciancare.com, for upcoming Facebook Live presentations that we'll be having. So thank you very much for joining us today. Again, my name is Dr. Sharyl Truty. I'm owner of Balanced Physician Care over here in Jacksonville area, located at the beaches. Our phone number is 904-930-4774, and our website is balancedphysiciancare.com. Thanks for joining us today, and have a great day.